I think the best analogy that I've came up with for that is like, if you think losing weight is going to solve your problems or make you feel any differently about yourself, put a 50-pound backpack on and go walk around for 10 minutes if you can. If you can't, do 20, and then take the backpack off. Great. You've just lost 20 pounds. Do you feel any different? Still the same person. You're exactly the same person. So man, you have such an incredible story. I could pick your brain for hours on just the different techniques. And I wanted to point out too, that you said like, you still have to work on this.
Dr. Morgan Nolte, welcome to the American Glutton Podcast.
Thanks. I'm excited to be here.
I'm excited to talk to you. You are a geriatric physical therapist. Is that correct?
That's correct.
All right. So I feel like for myself, like waist up, I'm not geriatric, but I think my legs, knees, and hips would fall into the category of like needing a lot of extra help.
Yeah, need some TLC. But technically, I think it's really anything 55 and older. There's a lot of people listening that are like, that means I'm geriatric. But I always like to say, well, if you're 35, you're geriatric for, a pregnant woman. So it's just a word. It just means I have a lot of experience treating older adults with lots of comorbidities and chronic conditions.
Yeah. I mean, I going into this thought of geriatric as being like, even beyond retirement age. So I was thinking like 75 or older, but like 55, I'm knocking on 55's door. So that I am literally almost within your age bracket.
Yeah. Yeah. No. Oh, go ahead.
No. And I think like, I was very overweight for a long time. So I probably got the knees of a 55-year-old.
That's kind of what I was thinking. I'm like, you had some excess, strain. And it's funny because I've seen you in so many things, but it's almost like I didn't know it was you until I was researching more. And I'm like, wow, he has such an incredible story. And I'm so glad that you have this platform and that you have this podcast and that you just get to have these honest, real conversations and dialogue with people. Because I think that there's a lot of people like me in this industry who the biggest weight problem that I've had was struggling to lose the baby weight, right? And that's nothing, I don't think, in comparison to what you've been through. So I think your story is so incredible. And thank you for just being that light, because a lot of people need that story and need your inspiration.
Thanks. Yeah. It's an interesting thing too, because I was put on diets as a kid, and then and I'm 48 now, but when I was 22, I kind of, for the first time, was like, oh, all those attempts my parents made, I'm interested in the results that they were seeking. Let me go out and search for this. And, I just don't think that it's a one size fits all thing. So like there were many instances of choosing a diet where I experienced weight loss. And it turns out that for me, weight was really a side effect of other issues that I had to figure out before like I could really address losing weight. That wasn't the biggest underlying problem because the weight kept coming back. And so even now, the kind of structure that I find that is useful for me maintaining my weight, I don't even know that that's particularly useful for everyone. Do you know what I mean? And so I'm really interested in having conversations with as many people with as many points of view as possible. And maybe at one point I dogmatically shared that point of view, and now I'm just open to hearing about it, so I'm really excited to talk to you too.
Yeah, thanks. Yeah, I think that there are so many different points of view and different ways of doing things. And the way that you were speaking, it made me think of mental weight. So that's kind of how I differentiate the two. I think that there's mental weight and physical weight. And often physical weight is a side effect or a symptom or a result of the mental weight. And so I say, like, you'll never lose the physical weight and keep it off if you don't also lose the mental weight. And so I think that's one of the issues with the dieting. Some of the medication use is it doesn't really get to the root cause, which often if you're digging deeper and deeper and deeper like an onion, right? Oh, you're eating too much, you're not exercising enough. Well, why? What are those thoughts and emotions that are driving those behaviors? I think that's really one of my passion areas. So I think, I always come on podcasts and we typically talk about insulin and insulin resistance, but I'm also so equally passionate about the mindset side of things because I understand I could give people strategy all day. And that's kind of like you have a garden, right? And you're not pulling the weeds out and tilling the soil before you plant the seeds and give it water. Like you're just watering more weeds essentially. So
Right.
I'm very passionate about that side. And I think that's why I have so much respect for you because I can tell by your results that you've done that work. You've done that inner work.
Yeah, it is a shocking thing to have the idea that, to your analogy, your garden, you're watering the weeds and expecting to have the garden you wanted. And it's kind of like one of those things where, like, I did all the hard work. Why do I not have the results? And, part of it too is like, you kind of have to like understand that the results aren't necessarily going to even be what you picture in your mind. You know what I
Yeah.
mean? Because, I had this idea of like what a normal person is. And like it turns out, like through many conversations with people I thought of as normal, no, nobody's really normal. People all have their idiosyncrasies and are plagued with one thing or another, even if on the surface it's like, no, what I see over there is everything I'm aiming for. And then you get there and you're like, well, this is miserable too. So
Mhm.
there's a lot more to it, I think, and then on the other hand, I also think probably the American diet, by and large, is kind of poisonous. And like, if a large swath of people just stepped out of that hamster wheel of, overconsumption of highly processed foods that are unbelievably delicious and calorically dense and leave you just hungry, we would probably see massive results. You could
Yeah.
probably get people situated, a large number of people, or at least see a huge dent in this thing that I think you and I agree is a problem, just by like some dietary changes, or, it could be even as much as like a change of environment, meaning like there are, um, food deserts. And, I've been to parts of Texas where, like, in a town, the only access to fresh fruits and vegetables was in an ice cream shop. Like,
Oh, wow.
it was wild.
Have
Um,
you been to the Grand Canyon by chance, like the Havasupai Reservation?
no, I mean,
Uh,
I've actually been quite close to it, but this is something that we could get into a whole vicious fight, not fight, but like contention with me and my wife about the Grand Canyon, where we've driven by twice and never really done what we
Ooh,
wanted to. Yeah, it's bad. So
you
no, not
should.
really. Yeah.
Before those like knees and hips get worse, definitely do it. So when I was in high school, we did a hike down into the Havasupai Reservation, and it was the most amazing vacation. First of all, it was with my family. I love being active and outdoors, and then we camped down there, and we hiked to the Colorado and did different waterfall hikes. And one of the most shocking things to me was the level of obesity of the Native American people. And I thought, how is this? They live in this beautiful place. Don't they need to like I was so naive. I'm like, don't they need to like hunt for their food? No, helicopters fly down all the processed foods. So
Oh,
at any
wow.
of the few convenience stores, all they have is like Doritos and Cheetos and pop and all the processed food. And then, you contrast that. I'm watching the show 1883 right now. Have you seen that one?
Yeah, it's awesome.
Isn't it so good? Wow. So then I'm thinking about the pioneers and how they did the Oregon Trail and how they literally had to go hunt deer and buffalo and corral things and walk all day long. They didn't have a fridge or like a pantry. You got what you got and that's it for the day. And sometimes
Right.
they didn't get much. And so I think that just how our culture has evolved with technology and convenience is one of the big reasons our environment has shifted. And because our environment has shifted, our eating habits have shifted, but our biology has not kept up, right? So we still have relatively the same biology as like cavemen and the pioneers, but we're feeding our bodies so much differently and we're moving our bodies so much differently. So those were some examples just recently, watching 1883. And then, yeah, the Native American population down there was very surprising.
Yeah, no, the whole thing is wild. So I want to talk about insulin resistance. Um, I had a very recently, I had like an oh wow moment. I have a daughter who has type 1 diabetes.
Okay.
So I've been thinking about and reading about insulin since I gave her her first insulin injection 15 years ago. And this came about because there was a very recent news article that using stem cells, they had I believe it was China, somebody in China had cured somebody of diabetes. Of course, it just says diabetes. And so my heart gets all aflutter because I'm very excited for, if this is really the next step, because they've got now kind of a crude technology for an external mechanical pancreas, which is just a tube that holds insulin and glucagon, and it will microdose you glucagon in order to. Anyway, this is a lot of complex stuff for, I thought maybe this is the breakthrough that's going to help my kid. And then you read the article, no, it's type 2 diabetes. And then there was a kind of a counter article that America's never going to let this technology in because it will mess with the insulin, the amount of insulin that's sold. And I had the thought at the time that was no way, because the majority of people taking insulin are type 1 diabetics, since type 2 diabetes is largely reversible or stallable through nutrition. There's no way people are letting it get bad enough to where they come to find out. How wrong am I? Apparently, there's like 100 times more people who are insulin dependent because of type 2 diabetes than are because of type 1 diabetes. Like it's not even close. So yeah, I mean, all of that could be true. I don't want to put on a tinfoil hat and say, America's not going to allow this technology in because the pharmaceutical, like, I don't think that's true, but that really opened my eyes to how big a problem, and I knew type 2 diabetes was a big problem, but I didn't realize so many people were dependent on external insulin sources because of it. I had no idea. I really thought that was a type 1 diabetes issue. And so I'm really interested to find out more about insulin sensitivity, because that really is kind of the first step on the path of being dependent on, like it's really bad. The kind of long-term effects of having elevated blood glucose. Like
Mhm.
it can get really ugly. Amputations, a loss of vision, kidney failure. Um, and so like I would caution anybody who is experiencing their blood glucose going above 120 ever to like think about this kind of thing.
It's really important. And I'm kind of curious. So, your daughter's had type 1 for a long time. What were those early symptoms for her that made you guys think, oh, I think something's off here. We better go get it checked out?
So my wife had family in Paris, and we were in Europe, and my kid. And so it just started one day with like, I think the first time we noticed it, we were in line to go to a museum, to get into a museum. And it wasn't an insanely long line. And in getting through the line, she had to pee twice, which was unusual.
Mhm.
And then you know, she was just like had inquenchable thirst. She was thirsty all the time. And then she got like a little tooth infection, and we had to put her on antibiotics, which I don't think is a typical symptom of diabetes, but like,
Infections can be, yeah,
yeah,
because
so
high levels of blood sugar increase the risk for infections. But
yeah,
that's interesting.
she had no issues with her teeth at all, and then one day she just had an abscess, and she was 4, and this was very just
Wow.
unusual. Yeah. And so we never we didn't know my wife thought she maybe had a UTI and that the infection had nothing to do with it, and was giving her, what's the juice gals drink? Cranberry juice. And then, she wasn't really sleeping, and she was kind of peeing constantly and drinking constantly. So we flew home and went
Mm.
straight to the pediatrician and described everything to the pediatrician. And the pediatrician did no other tests but prick her finger, test her blood sugar, and send us to the hospital. And even, we were kind of at the time, uh we just knew nothing about it. And so our first instinct was like, no, diabetes is something that we handle through nutrition. So we're not going to put her on insulin. This
Mhm.
this lasted a couple of hours,
Yeah.
sitting talking in the hospital with them, and we were like, well, so she doesn't eat sugar anymore, and not that she even really ate much sugar. We we're kind of granola-y people, and we, they weren't eating like sugar cereal or anything like that. Or anyway, um and we came to find out, no, these are two very different things, type 1 and type 2.
Yeah.
And the beta cells in her pancreas that produce insulin had been killed off, and she had a blood sugar level of 750. And
Whoa.
yeah, and the doctors in the ER said, you're very lucky that she's not in a coma, and that you came in here with her, still very coherent, and, more fidgety than normal, certainly, and irritated, but not needing immediate life-saving measures.
Yeah. Wow.
So yeah, and she's been insulin dependent since then.
I think, did you know it used to be called the wasting disease?
Yeah.
Yeah. So I think that's an interesting place to start off this discussion with insulin resistance, because a lot of people think insulin and they think, oh no, like, it's not going to be good. I'm going to get insulin resistant. And I like to say you need insulin to survive. And without insulin, your daughter unfortunately wouldn't be here, and so many other people with type 1 diabetes. So it used to be called the wasting disease because insulin acts as almost like a key to let the glucose into the cells. And so what she was eating was being broken down into glucose, okay, right? But then the glucose just hung out in her bloodstream. It never got into storage. So many people experience weight loss or difficulty gaining weight with type 1 diabetes. And I think that's the perfect example of why losing weight is not only about calories in, calories out. Because without insulin, you cannot really store as much of those nutrients as you need to. I mean, the only two ways that it's called a GLUT4 transporter. It's like a tube slide for the glucose to get from the bloodstream into the cell. And the only ways they get to the cell membrane are insulin or exercise. So insulin is kind of the passive mechanism, and then exercise creates muscle demand, almost like a sponge to soak the glucose up, no insulin needed.
Hmm.
So type 1 diabetes is, yeah, you don't make any insulin at all. You need it, via injection. Type 2 diabetes is completely different. And I think the reason that they call them both diabetes is because of the sugar, right? But they're completely different. So type 2 diabetes takes a long time to develop, whereas your daughter's kind of came on pretty suddenly. And then with type 2 diabetes, it's caused by insulin resistance. And so if you have prediabetes, if you have type 2 diabetes, if you have high blood pressure, if you have high triglycerides, if you have excess belly fat, you likely have some degree of insulin resistance, and you're not alone. 88% of adults in America have some degree of insulin resistance, which is
Wow.
bonkers, right? Bonkers. That's even higher than the number of people who are overweight or obese, right? So that's about 8 out
Right,
of
because
10.
it's not all heavy people that have this.
No.
That's a great point to make, because and let me totally glean what you're saying here.
Yeah.
You would be saying most overweight people have this, but also a ton of people who aren't overweight have this.
Yeah. So that's called thin on the outside, fat on the inside. So TOFI is the clinical definition for it. And what that means is you have too low of muscle mass and too high of body fat, but you're still at a normal weight.
Right.
And so those people can still be insulin resistant. And in fact, one of my geriatric PT patients who had the worst case of diabetes that I'd ever seen fell. He was on the floor for 3 days before his neighbor found him, multiple wounds, couldn't walk. He was underweight. And so he was very insulin resistant, but also underweight. So that's important to recognize that even if you're at a normal weight, you could have insulin resistance and be at risk for prediabetes or type 2 diabetes. The other thing I always love to share on other podcasts is that we need to be checking fasting insulin in everybody. That should be standard on a blood test. And the reason is because your insulin levels will be rising slowly in the background for 10 to 20 years before you see a rise in your glucose or your hemoglobin A1C, which is like a 3-month estimate of blood sugar levels. So,
okay. So I want to understand one thing.
Mhm.
Checking insulin levels is not a finger prick at home. That's a real blood test, right?
Actually, that we do. So we've partnered with a lab to be able to sell an at-home finger prick insulin test.
Oh, wow.
But it's a completely different test than like the Keto Mojo device or a regular blood glucose monitor where you prick your finger. It's also different from the continuous glucose monitor, like what your daughter probably has and what many people have heard of these days. And that's a measure of your glucose. And glucose is a downstream effect of your insulin sensitivity or your insulin resistance. So that's why we want to be proactive to check insulin, because if you're just checking glucose, you're just checking hemoglobin A1C, you're not seeing in the background that insulin level going up and up and up. And ultimately what happens is your cells become resistant. So think about like an alcoholic who used to get buzzed after like 2 drinks. Yeah. And now it takes 6 because their cells have become resistant to the effects of alcohol. Well, your cells also become resistant to the effects of insulin if they're exposed to high levels of insulin over a long period of time. And that we can talk about why that happens, like what raises insulin. And so we really want to be checking that fasting insulin. There's at-home tests. People can go to Ulta lab tests and then insulin if they just Google that keyword. It's about a $30 test that they can order themselves and go to either a Quest or a LabCorp. They can ask their physician, but most physicians that I have heard about do not even understand why it's important to check for insulin.
Yeah, I just want to say, I don't know that I've ever heard anybody remark or seen it on a metabolic panel what my insulin levels were.
Most of them aren't. Yeah. So if you're just doing like a standard blood draw, it's not on there. You're going to want to ask your physician, and it's okay if they give pushback. It takes, from last I researched, 17 to 25 years for evidence to like trickle down into clinical practice. And I like to joke, like your physician could be dead or retired by then. So
maybe, yeah, he'll retire and he'll be like, we need to start checking insulin levels.
Yeah. So you just do it yourself. And a good insulin level is going to be like around 2 to 6. Anything higher than 6 is you are at, you have a little bit of insulin resistance. We want to be tightening up your lifestyle habits. So I think that's one of the biggest things that I wanted to share with your audience is that type 2 diabetes and pre-diabetes, gestational diabetes, they're all caused by insulin resistance. And you can have a 10 to 20 year heads up on your risk for these conditions, which is like a 10 to 20 year opportunity to change your habits and prevent them in the first place if we get our fasting insulin checked.
All right. Okay. So this is, I love this too. I love having these conversations with people because I am quite often given these little bits of data where it's like, oh, I have something new to do and investigate, which is fun. But then once that's determined, so like, okay, you're not getting poor A1C scores yet. You're not seeing a ton of evidence of prediabetes with, your blood sugar levels on normal doctor's visits. Or even if you're one of these people who I think of as extreme, who look fit to me, but are wearing CGMs despite no diabetes at all, having seen the first iteration of that, however many years ago, when my kid told me about it and she had to have it and insurance refused to cover it and it was a fight and we got one, to now today, You go into a gym, you can see a bunch of people wearing them, and you know that they're wearing them uh, to for what I think of as just for fun. Um, but what are the solutions here? Is it nutrition?
Well, that's a big piece of it. And so the way that I like to teach it is there are kind of four pillars of lifestyle factors that we want to address for insulin resistance. And then all of those pillars are on the foundation of mindset. And that kind of goes back to the start of this conversation where we can manipulate one of these factors, but you have to develop mindset skills. I would love to dig into what you did, like how did you kind of do that inner work? But nutrition wise, what has been found to be most effective, especially for people who have insulin resistance already, is a lower carbohydrate diet. There are a couple of exceptions for people that can tolerate more carbohydrates, and those are athletes or people who are very active. So it's not necessarily I'm saying you need to do carnivore or you need to do keto. I'm kind of like you. I really like to look at the evidence. I like to be open-minded about every approach. And I like to say, okay, what's best for this person at this point in time? But a lower carbohydrate diet is good because the starches and the sugars, which are types of carbohydrates, those are going to be the one that spike the glucose the highest. And when your glucose spikes, your insulin spikes again to shuffle that glucose back into storage. So I would typically recommend maybe like 80 or 90 grams of net carbohydrates a day is a good starting point, and then see how your body adjusts from there. So that's like, think about 30 grams of net carbohydrates per meal. It's like a banana or a small serving of whole grains, or a few servings of non-starchy vegetables. There's so many different ways. I think tracking macronutrients is really helpful here. Then the second thing is high protein. So the more muscle you have, the more space you have to put glucose after a meal so that it can get into your muscles fast, get out of the bloodstream, stay out of your fat tissue. So we want to develop a lifestyle that really supports muscle mass. And that requires two things: high protein diet and resistance training. So with protein, I typically recommend at least 30 grams, but really 30 to 50 grams of protein per meal. And then on a per day basis, I like to recommend 1 gram per pound of ideal body weight, which is, subject to interpretation there. So that's why I say start with that 30 to 50 grams per meal. So like this morning, I had 5 eggs for breakfast. That's 30 grams of protein. It's also about the size of your hand. So if you have like cut up chicken or cut up steak, the protein serving size I recommend per meal is like that amount of protein kind of cut up on your plate.
Yeah.
And then go ahead.
No, I want to hear the other pillars. I'll enter this into the equation later. Keep going.
Okay, I'm excited to hear what you have to say. The last macro is dietary fats. And so we really want to prioritize the healthy whole food fats, olives, avocados. This is not rocket science. The more whole, real, unprocessed food you eat, the better for your health. And then part of the nutrition pillar too is intermittent fasting, which is one of the most effective ways that people can really improve their insulin sensitivity, reduce insulin resistance. 12 to 14 hours a day seems to be a great starting place for for most people. That's like stop eating after dinner, like 7.
Eat at breakfast.
7. Yeah. That really challenges people to cut out the late night snacking or the middle of the night snacking habit. And then have like 3 structured meals a day. So we don't want to be grazing all day long and spiking our blood sugar and insulin. You want to have a dose of food, especially with the protein, and then let your body rest and digest, and then have another one. So that's a good starting point. But if you're very insulin resistant, you might need a little bit more of an aggressive lower carbohydrate or fasting protocol. We always have to balance that with the psychology of the person too. So eating disorder history, that kind of stuff.
Yeah.
Go ahead.
I find personally that I do have a window. It's a little higher than you said, but this is my personal window. I also have a lot of muscle mass. But
You do. Yeah.
But I've had trainers before say to me, like, you could be eating 400 or 500 grams of carbs a day. And when I try that, I don't feel great. So that's really what I go off of now. And I will say, as far as like, and this is all anecdotal, so I'm not saying that any of this is, this is just my experience. But I know that for me, if I'm in the gym and it's a really hard workout and I'm pouring sweat, I can get lightheaded, and that lightheadedness can be immediately eradicated with like a Gatorade.
Yep.
If I
The
was to,
carbohydrates.
yeah, and they get into me and I feel the effect really quick. If I was to drink that Gatorade while sitting and watching TV, I would feel hungover. And I've literally done this. I even like this what's it called? Halo Top ice
Oh, the
cream.
ice cream. Yeah.
Yeah, which still is 60 grams of carbohydrates. And when I
Mm.
have that at night, I feel, I think they have a keto one too. I don't mess with keto because it is a lot of calories from fats, and those are fats that are not olives and avocados, right? Which
Yeah.
I too like to get my fats from those types of sources. But so I'll have a halo top at night and I'll feel hungover in the morning. And it's like, yeah, I didn't go outside my caloric zone. I know I've got a pretty good without crunching numbers all day anymore because I did that for a while and I now have like a sense of how much I can eat in a day. Because I think I broke all the systems in my body that tell me honestly how much I can eat, right?
Mm.
But this was for other reasons, which we can get into. Um, so, I don't have rice with dinner, and then I have my Halo top, and I feel like garbage the next day. And I do think there is something for me personally where I have some threshold for carbohydrates where if I go grossly above it, I don't feel great. And even the sourcing can be different. The one caveat I would put on this is I could probably like blow these numbers out of the water if I was getting the carbohydrates through things like Brussels sprouts and cabbage. Those do not seem, those could sit in my gut and give me gas or indigestion because I try to get a lot of fiber, but sometimes I overdo it and it just doesn't feel great in my stomach. But I don't feel the sluggishness I
Yeah.
have felt from, do you know what I mean? So,
I know what you mean. Yeah.
and like fruits too. I could eat a bag of apples and not get the carbohydrate hangover. So I do think there is something to this idea, at least for me personally, where the sources make a difference.
Yeah. It's not just the macronutrients in the food or the micronutrients. It's like, just think about the level of processing that Halo Top ice cream went through, right?
Right. It's
I'm with
delicious. It's low calorie, but
it is.
it can screw you up.
It can. And I'm with you. Like we live in a 100-year-old home in a farmhouse. And so we're doing a lot of remodels over the last year. And I just spent hours and hours and hours ripping up carpet yesterday and then 2 days ago. And I was beat. And so I had more carbohydrates because I'm like, I am working all day, but I just don't tolerate them well anymore. Like I felt sluggish. I felt irritable. Um, they just like weigh me down in a different way. And so I had kind of a combination. They were mostly whole food carbohydrates too. So I think it's so important, like you said, to listen to your body. But if you are going to have carbohydrates, the best time to have them is either like right before your workout or during your workout or about 30 minutes following your workout. There's like, I call it the golden window for carbs. Because you know those GLUT4 transporters I mentioned, the tube slides?
Yeah.
So exercise puts those on the cell membrane of the surface for glucose to come in. And they stay there for about 30 minutes after your workout is done. So you can have carbs and they can just slide on in, soak it up, let the muscle soak up the glucose, form the glycogen so you have energy for your next workout.
Yeah.
So that's a little bit more of an advanced technique is that carbohydrate timing around your workouts. But I have found that to be really effective to help me perform better during workouts without that like carb hangover effect that we've been talking about.
Right. Yeah, no, and that has been something I've experienced where, there was but I also will say for a long time I was anti-carbohydrate. I believed that carbohydrates were the sole source of making me fat. And
Mm.
what I found out is like I can still overeat ribeye steaks, I
Yes.
can I can
Yeah.
overdress my salads. Even when I'm going like this salad has 30 grams of carbs, I don't get any more carbs for the day, but I can pour way, my wife once said to me, how much olive oil is that? And I said, it's a tablespoon. And she said, did you actually measure it? And I said, no. And she poured my salad into a measuring cup and it was like a quarter cup, which is like,
Four
you know,
tablespoons.
right. It was insane. And that was like not even including the rest of the oil that was stuck to the lettuce.
Yeah.
So,
Probably
so
500 calories of olive oil, which
right,
we said is a healthy fat, but I think that's where calories come in. So I like to say low insulin calories, which would be the fiber, the fats, the protein. Those are still calories. And so in that regard, those calories do still count.
right. Yeah, it all gets very tricky. I wanted to ask you, and this, and like in real life, I'm not trying to hand out advice to people because I just don't think it's my place, especially if it's unsolicited. But I was having dinner recently with a guy who was wearing a CGM and had an issue with his kidneys, and we didn't get into exactly what his issue was, but he had to be on a low protein diet, which I've read about a little bit because there have been times because high protein works very well for me. I can dump protein into my body and it only makes me feel better. And so I'm like an advocate for that, not in that like I think everybody should do it, but it has worked really well for me. It curbs my appetite. I'm not sitting dreaming about food when I'm getting enough protein. You know what I mean? Like it is
Yeah.
helpful. Um, and then I have had a few instances where people with kidney issues have come to me and said, like, this is really bad that you're suggesting high protein. And I'm like, look, I've always said, I think it's on an individual basis. I really do think any of this is like, you got to find what works for you. And I don't think that, and I know that there are some instances where people with kidney problems have to be on low protein. But I don't think that's nearly even as common as like type 2 diabetes.
Oh,
Um,
no.
so I'm talking to this guy. He has a kidney issue and he's on a CGM and he's saying he has to be on low protein, but that he's also pre-diabetic. And I'm like, well, then you should be moderate carbs too, right? And I like, what does the guy have left to eat? Just fat? Like, you know what I mean?
And it is person specific, but I found at least a couple really well done studies that say even with kidney disease, that minimum dose of like zero point 0.8 grams per kilogram of body weight a day is appropriate. And again, you'd have to run it by your nephrologist or whoever's, giving you that dietary recommendation. And I would still recommend the dose is important. So that 30 grams a meal, get at least 3 grams of leucine, which is that essential amino acid that triggers muscle growth. And the way that they justified that was the risk of your protein to that, you know, low protein diet, which is like the US government recommendations essentially is low. Those risks to the kidney are outweighed by the risk to the rest of your body if you're underdosing protein, and those risks are huge. We're talking osteoporosis, osteopenia, sarcopenia, so muscle loss. Your hair and your nails are going to get thin, but man, just the physiological effects of like constantly craving food, wanting food, being hungry all the time. All of those are going to be solved with a higher protein diet. So I would really encourage that person and whoever has a protein limitation to do their own due diligence and research and come to the table with some of these research studies that recommend 0 0.8 grams per kilogram of body weight a day, even if you have kidney disease. And I would just go to Google Scholar and I would look up 0 0.8 grams per kilogram of body weight protein kidney disease. And I'm guessing that a couple research studies would pop up there.
Okay, and what is leucine found in? Just so I know, where do you get that?
All animal products. So leucine is one of those essential amino acids. Animal products I recommend for insulin resistance because they're naturally far, far, far lower in carbohydrates pretty much zero compared to plant-based protein. And so there's an example I like to give of quinoa versus steak. So quinoa, a lot of people think, oh, it's high in protein. It's a high protein grain. Well, you can have 4 ounces of steak and get like 35 grams of protein at about 180 calories. Okay. Or you can have 3.5 cups of quinoa for about 800 calories and 30 grams of protein.
Right.
And
And
the
no
protein
leucine.
and very little leucine. Yeah. So we want to be not just eat the protein, eat the macros, but eat for those essential amino acids too. So that's why anyone who's vegan or vegetarian, I usually recommend a branched chain amino acid supplement to get a little bit of extra leucine at each of your meals.
Yeah, I also think on this subject, I recently was looking at studies where there was the idea for a very long time that kidneys were not regenerative, and that has been disproven. Like they can heal on their own, and
That's
and
it.
not for somebody who has like kidney disease to just like say forget it and I'm just going to eat chicken breasts. That's not my suggestion. All of this
Mhm.
should be done through a doctor. But I did read recently that they can prove that kidneys can heal.
Interesting. I think our body's incredible. It's interesting. It just doesn't surprise me.
Yeah.
We just have to, we have to create the environment in which they can heal.
Yeah.
That's our job.
Yeah. I think that the standard American diet, again, going back to that, protein, other than like you're starting to see it more and more in bars and
Mhm.
processed foods, it is catching on a little bit there, but that's still like, I don't think those are good trade-offs for having a whole food meal.
No, and I think when that's again the importance of looking at the ingredients, not just the macros. So I'm getting more and more interested in gut health too, because inflammation will contribute to insulin resistance. So high levels of insulin are inflammatory, just like high levels of blood sugar are inflammatory. Well, high levels of inflammation can drive insulin resistance too. And when we're eating these processed protein bars that have ingredients like carrageenan and soy lecithin, so soy lecithin, and I see other types too, that's a food emulsifier, which is a byproduct of soybean oil production. And we know soybean oil is highly inflammatory, just like canola oil. And by the way, when I was in PT, I would like look through people who just had a heart attack. I'd look through their discharge paperwork. The registered dietitian is still telling them to eat canola oil, reduce saturated fats, et cetera. Another conversation. We really want to reduce these inflammatory oils and inflammatory ingredients like these food emulsifiers, like polysorbate 80, I found in pickles of all things, and so we have to be very mindful about just because you're getting a pickle and you think it's a whole food, look at the ingredients, read the ingredients, be sure that you know what all of the ingredients are, because all of those food additives, what they do is not all of them, but many of them will cause leaky gut. And so the leaky gut will then contribute to whole body inflammation, which can, increase your likelihood of getting insulin resistance. And a lot of these foods, just like the Halo Top or protein bars, they can call themselves keto because they have, a pretty good amount of carbohydrates still, but then they stuff a bunch of fiber in it. And the net carbohydrates is the total carbohydrates minus the fiber. Okay. But the fiber that they put back into the food will never be as good as fiber from real whole food. Your body just treats it differently, essentially. And that's why you're going to see so much gas and bloating with those protein bars. I know personally, like erythritol and me are not friends. And so many low carb, like chocolate options have erythritol. It's a contentious spot in our marriage because I just get too gassy and
Right,
Justin's just
right.
like, just leave, leave.
Right. I've had enough of this.
I've had enough of your erythritol. So we have to be mindful about the ingredients. And just because you can see it and you know it's a pickle
Yeah.
doesn't mean that that's all that there is in there.
Yeah. Okay. If we go back to the mindset piece, which you
Mm-hmm.
advocate for, which I do agree is so important, I would say, like, for me as a sober person, um, I tried to like white knuckle sobriety a number of times. And this is even before I on my own was confronting my weight and because it was actually going to kill me very quickly. So it was a more present danger that had to be dealt with. And
Yeah.
for a long time, I thought sobriety was just, you know, if I could get the drugs out of my system, I could be sober. And so what that would look like is me locking myself in my house for a week. And then the day I started to feel not as crappy, I would go like, well, I can drink. Drinking's okay because I wasn't physically addicted to alcohol. So I'm just going to drink, and that'll, add the flair to my life that gets me, because I'd be sick in my house alone, kind of just pacing, feeling miserable. And, I think the longest I went that way was like 2 days before I was calling drug dealers again. And so I learned very quickly, like, okay, it's not just about like getting the drugs out of your system. I have to actually start looking at like the reasons that life is so bad that I need to supplement with drugs in order to get through a day. And that was helpful. I didn't put that together with food for so many years. For
That's
me,
so fascinating.
it's what there was some
Um,
cognitive dissonant disconnection where I just thought if I can lose weight, if I can get rid of the fat, the problem is the fat and the problem will not be there and therefore the problem won't exist. And what that looked like was, you know, again, lock myself in my house for 60 days and do like a liquid diet and emerge having lost 80 pounds, like, well, there's 80 pounds of the problem gone, and then just watch the rapid reaccumulation of the 80 pounds over and over and over. And I guess I was doing putting a slightly bigger dent into what I perceived to be the problem because I did eventually, after 10 years, get down to what a doctor said was an ideal weight. But my life at the time looked like 8 hours a day of cardio, not an exaggeration, truly 8 hours a day of cardio, withholding food to the point where I would not allow myself to eat while not riding a bike. It was only
oh
food
my
on the
goodness.
bike. And then at night for dinner, I would have something called, I don't even know if this exists anymore, called Carbolite, which was like,
Mm.
uh, still probably had a bunch of carbs in it, but it was like a sugar-free frozen yogurt. And there was a place near my house, like still on Twitter to this day. The place does not exist anymore, has not existed in 10 years. But if I do a search on Twitter, that's the first thing that pops up because I checked it multiple times a day, every day for a couple of years.
Wow.
Yeah, it was wild. Studio frozen yogurt, it was called.
Huh.
And they would change their Carbolite flavors every day or every few days. And I was just like, what is my dinner going to be tonight?
Mhm.
Um, and that was just like a structure that was insane. And I was
Oh
also
yeah.
scared of carbohydrates. Like when I finally like realized like this is not the life I want. I don't see my wife and kids. When I finally get home, I'm exhausted. I'm useless and I'm just thinking about food all the time and just withholding food from myself. Um, I eventually had to go like none of these structures I've thought up have really dealt with the problem long term. They're kind of like something that if I cling to desperately, I can experience weight loss, but I'm only experiencing weight loss. I'm never maintaining weight ever under any circumstances.
Mhm.
And so, I really had to start to confront that my involvement with food was really just me seeking to avoid discomfort, and that means like emotional discomfort and even physical discomfort and uh, sadness and or heightening joy. All of
Yeah.
that, those kind of things were how I was interacting with food, and it was hard to kind of separate myself from that because that'd been like at that point 30 plus years of this is how I live life. When I'm not feeling good, food makes me feel better. When I'm anxious in any situation. At the airport, I don't love flying, but I find myself flying all the time. And so that anxiety can be quelled with food, or just sitting alone bored. That boredom can be, enhanced with food, or just really not liking myself. I can ease that discomfort with food. Um, it was really those things that I had to kind of tackle and go like, what do I want from my body? What do I want from my life? And what do I really want from food? And if my interaction with food in these ways, if I'm using food to enhance my life in these ways, are there any other avenues that I could swap out and substitute food for something that maybe will lead to because the other thing that I think about is like, when I am avoiding discomfort right now, I'm just kicking that discomfort down the road,
Mm.
and down the road it tends to be worse. And it was the same
Yeah.
with drugs. And so if I just experience that discomfort right now, maybe once I'm through that, I won't be so uncomfortable. That's just a moment in time. I find that with anything uncomfortable that I've experienced, it's not permanent. It's kind of like temporary. And so like getting through the discomfort now, not kicking it down the road, is a better reward system for me than like going, I'm going to put feeling that off and experience it later, when it actually compounds in that way. And so
Yeah.
like going to the gym is not always comfortable, but I feel better afterwards. And that can get lopsided too. I can, be so avoidant of being comfortable that I always have to feel discomfort, which is what I think I was doing while riding the
Mm.
bike 8 hours a
8 hours a day and only eating on the bike. Yeah.
day. Right.
I think, have you heard the phrase like there's sacrifice either way and you can choose your hard?
Yeah,
I,
totally. It's
that's
great.
that's really resonating with me right now from your story. Is yeah, it's hard. Like change can feel hard. It can be hard to confront your emotions. It can be hard to confront your environment and the people in those environments. And you probably had to, I'm guessing, do a whole identity change. Like,
Yeah.
did you have friends that you did drugs with? Like that you had to like totally change your friend groups and kind of change your identity as a human being, almost from like the guy that struggled with that. I'm thinking of one client in particular who is going through this identity shift. He used to drink a lot, very diabetic. He's like, I can't do that anymore. And I'm very much struggling with that identity shift of like, I was always the fun guy, the life of the party. And now I don't know who I am without alcohol. I don't know what role I fill in my friendships without alcohol. Did you go through any of that kind of identity shift?
I did. Yeah. With drugs, I will say and a lot of this, um, I was ashamed of it, and I did it mostly in secret. There were certainly, like my drug dealer who I became friends with. To a degree, we weren't doing sleepovers, but to a degree, we were friendly. And there were definitely pockets of people that I knew I could do drugs with, that some of them died, some of them got sober. And thank God that the ones who made it and got sober. And then there are some who I've gone like, well, I can't be your friend while this is your life, but for the most part, I was so ashamed of this kind of behavior that I did it secretly, even with food. I was a guy who would go to dinner with people and order very little, and then on my way home, hit a fast food place
Yeah.
and just binge eat on in private. But yes, to your point, I I found it incredibly helpful to seek out like-minded people who were urging towards the positive stuff that I wanted and associate more with them. And with my family, I've been on so many diets, and I have a bunch of kids and a wife, and none of them really need to diet. And so I think that to some degree, I probably did do some harm showing them this kind of behavior with food for so long, and that I feel guilty about. But at the same time, I have afforded them freedom to also kind of make the mistakes that they need to make for themselves and to figure it out, but to be here to have conversations when they want to also.
Yeah, I think something that's really inspiring about you is your grit. And, you said it took 10 years to kind of figure this out at least. And what kept you going? Because I know that people try and then it doesn't work. Like you said, I'd lose 80 pounds and gain it right back. And there's so many people that have that experience, but then they give up. And so they give up, just shy of reaching their goal. So I'm kind of curious for you, what kept you going? What kept you inspired and motivated to like keep trying even after it didn't work?
Well, I think unfortunately, because it's the hamster wheel that I would love people to get off of, but I think it was the evidence that if I can lose the weight, I can be successful. You know what I mean? Like
Mm.
that kind of proved. I think about that, and I'm blank on what it's called, but there's the rat study where this guy, and it's a horrible, very mean, sounds awful, study done on rats where a guy put rats in a bucket of water and he watched them and they drowned at 15 minutes. Um, that's sad and really awful. And then he put them in water and pulled them out at 14 minutes and gave them a little time to recuperate and then put them back in the bucket of water and they swam for 60 hours. 60 hours
Interesting.
because they had that little fire of hope. If I just keep holding on, somebody's
Oh,
going to pull me out. And I think
wow.
the fact that I saw that I was able to lose weight gave me that hope to keep going. And, I was in my 10th year, or no, it was more than that. It was really my 15th year of treading water in that bucket, going
Dang.
like, I can do this. I know there's some belief that there's hope there. And that was because the first time I really tried dieting I think, on my own, I had success, meaning like I locked myself in my house for 60 days and did it. And that's not literally true, but I did spend the majority of
Yeah.
my time at home, not being super active, consuming 600 calories a day and obsessively watching food TV because I needed that like sublimation with
Had to
food.
get it somehow. If you're not through your mouth, then through your eyes.
Totally. And this was in 2002. And I think food TV was kind of newer. I'd never seen it before. And I was like, oh my God, I can just watch people interact with food all day while I sit here starving
I
myself.
love
And it was great. And I came out of that going like, I lost 80 pounds.
that.
Um, and then I quickly put it back on, but I knew that like it was possible. And so I just kept going and back and forth until it was that thing where it was like, oh, I'm, you know, I have this chronic headache and I keep taking Advil thinking my headache's going to permanently go away and it keeps coming back. Maybe I got to go investigate if there's something more to, maybe I'm sleeping wrong and my neck's out of place every day and I get a new pillow and it's like, oh, I don't need the Advil anymore.
Yeah. Kind of getting to the root cause. And I know we're kind of coming to the end of the time, and I had a couple other thoughts for you, but I just really wanted to share the rest of the pillars in case people are like,
Please.
I want to
Yes.
hear. But physical activity, stress management, sleep. And so if we're not sleeping, if we're too stressed, if we're not physically active, all of those things will contribute to insulin resistance as well. But going back to yours, I'm just fascinated in your story because I work with so many people who it's not like this is instantly successful. But one thing that you said to me that really stood out was, I thought if I would lose the weight, then I would be successful. And didn't a lot of your career success come when you were overweight?
Yeah. Most of it.
So that was very interesting to me that success is so subjective.
Yeah.
It's such a feeling. And so like outside looking in, somebody might say, wow, he has so much success, but you didn't feel it on the inside.
Well, and that's the other thing that's crazy because I expected a mental shift. I expected, and this is kind of the biggest thing, I expected to like myself. I expected to wake up one day and feel okay with myself and not have self-loathing and go like, I'm a decent person and I don't deserve shame. That never happened at any weight. I felt
Yeah.
shame every day, no matter what. I
Yeah.
still have to work through that. The thing that I would say is that it gets easier, but that is kind of the biggest thing. I expected this mental shift to happen. I expected this nirvana. I expected to
Mm.
feel normal, and I just never did. My life, largely, my problems, which I viewed all through the lens of weight, they still existed, and I expected them to all go away, you know?
Yeah. I think the best analogy that I've came up with for that is like if you think losing weight is going to solve your problems or make you feel any differently about yourself, put a 50-pound backpack on and go walk around for 10 minutes if you can. If you can't, do 20, and then take the backpack off. Great, you've just lost 20 pounds. Do you feel any different?
Right. That's it.
You're still the same person.
Yeah.
You're exactly the same person. So, man, you have such an incredible story. I could pick your brain for hours on just the different techniques. And I wanted to point out too that you said like you still have to work on this. I still have to work on this. I have really good daily mindset processes now that I skipped. When did I skip them? On Monday. So 2 days ago, my son was up and he wanted breakfast right away. And so I negotiated with myself. And I think that's really important. You said after like a week of not doing drugs, you were like, all right, I can have alcohol. You negotiated with yourself. You negotiated down with yourself. We always want to negotiate up with ourselves. And so that's something that people can reflect upon. Like, where did I negotiate with myself today? Where did I justify my actions today? Where am I justifying my bad habits? But what happens when I don't do my daily mindset processes is it's a negative spiral for the rest of the day.
Yeah.
And I'm more reactive. I eat more. I'm not the mom that I want to be. I'm not the wife that I want to be. My energy level's lower. And I think that's why like that foundation is mindset. And if you can only develop one habit, what I would recommend is do like a daily mindset routine, do the gratitude, do your wins, develop, like you said, like the shame, like say what you're proud about for yourself, say what you're grateful for yourself. Like think about what concrete things you want to do today to move closer to your goals. Think about any obstacles that could arise. Like those are the types of things that I have found to be very successful. And when you do this daily mindset routine, it's free, it takes no physical activity, and it builds your self-esteem for anything else that you want to get done throughout the day. So if people are sitting there like, God, where do I start? Where do I even start? Like start with some morning gratitude and
Yeah.
just watch it raise your vibration, watch it give you more energy, and watch it have like a positive spiral effect for the rest of your day.
I cannot agree and concur with you more on that. My day is largely shaped on how I decide it's going to be. The day will be what the day is, and I can either perceive it to be good or bad, negative or positive, something to grow from or something to learn from. And that's just a decision that is
Yep.
usually made first thing in the morning.
Yeah. Well, I think you're awesome. I think that your grit has just been evidenced, for your entire life. I'm sure I've heard acting is not an easy profession, not an easy career to get into. And then, use that grit to become sober. And then you use that grit to change your health. And I just think you're awesome. So thanks
Thank
so
you.
much for inviting, like just for letting me come on the show and talk with you and share some information about insulin resistance with your audience.
Thank you so much. I think you're awesome too.